Welcome to Chapter 8. Please open your textbook to page 172. Skin disorders and diseases. Please know the skin is the largest organ of the body. Please star and highlight that. It is vital to our every existence. While it's designed to protect us, it's also our most visible organ. And healthy skin is often associated with good health in general. Choosing a career in skincare to help provide maximum skin health and overcome or reduce the effects of skin disorders can be super rewarding. Skincare specialists are in high demand in many salons and spas and earn excellent salaries. Some stylists find caring for the skin less demanding physically than styling hair and choose to balance their day by scheduling services in both areas. Whatever your reason, skincare in this area of rapid change and growth and topic, it's really on most clients' minds. Knowing the basics of skincare and how the skin functions will allow you to advise clients on their skincare regimes and when they seek your professional opinion. Let's move over to page 173. Let's talk about the lesions of the skin. Please highlight. A lesion is a mark on the skin that may indicate an injury or damage that changes the structure of tissues or organs. End of highlighting. A lesion can be simple as a freckle or as dangerous as skin cancer. Lesions can indicate skin disorders or diseases, or may be symptomatic of other internal actual diseases. Being familiar with the principle of skin lesions will help you to distinguish between conditions that may or may not be treated in a salon or spa. A primary lesion of the skin. Please highlight. Primary lesions are lesions that are different in color than the color of the skin, and or the lesions are raised above the surface of the skin. End of highlighting. They are only often made different by the size and the layers of the skin affected. These require a medical referral. When we flip over to page 174, there's going to be a great table, 8-1, for a description of primary lesions, an example of each. A primary lesion would be a bulla. You can see the image right there. It's a large blister containing a watery fluid similar to a vessel. It requires a medical referral. Examples would be contact dermatitis, a large second-degree burn, impetigo. Let's move over to a cyst or a turbuncle. You sometimes see these. They're large and they're raised. They're pretty gross to physically look at. The description, please highlight your cyst and also the description. They're closed, they're not open, they're abnormally developed in a sac that contains pus, a semi-fluid, or some type of morbid matter, above or below the skin. A cyst can be drained of fluid, and the turbuncle cannot. It requires a medical referral, and they'll actually have to cut it out. Please highlight a macule. You can see that the nice image of that macule right there. It's kind of like a big dot on the skin. It's flat, it's a complete flat spot, but it's a discoloration of the skin. Please ensure you highlight the description and also the name. We call it a freckle or a liver spot. You can see nodules also. These are pretty common with people with severe arthritis. They're a solid bump larger than 0.4 inches or 1 centimeter. They can be easily felt. Obviously, always needs to be referred to medical professionals. If you're a pedicurist, you sometimes deal with these with your older clientele with their feet. Let's move over to a papule. You can see those raised little red bumps. It's a small elevation of the skin that contains no fluid, but it does have the ability to contain pus. This could be acne, warts, or elevated nevi. Moving over to page 175. Please highlight a pustule. You can see the image there, and I want you to again please star and highlight the description. It's raised, inflamed papule with a white or yellow center that contains pus in the top of the lesion. An example would be acne or impetigo. Can you please highlight tumor? If you look at the image, you can see that it's an abnormal mass. It's varying in size and shape. It's slightly disordered. Any type of abnormal mass, not always cancers. It always requires a medical referral. A vessel. You can see on the inside of the arm in that image, it's a small blister sac containing a clear fluid lying within or beneath the epidermis. It also requires a medical referral. The cause is unknown or untreatable with over-the-counter products. Lastly, your wheal. It's an itchy and swollen lesion that can be caused by a blow, a scratch, a bite of an insect, or skin allergy, or sting of a nettle. Typically resolves on its own, but a referral to a physician, if it's considered, lasts more than 3 to 4 days. Now that is the closure of your primary lesions. Let's move on to secondary lesions. Please highlight. Secondary skin lesions are characterized by piles of material on the skin surface, such as a crust, a scab, or a depression on the skin surface, such as an ulcer. So that would be an open form. Let's move over to table 8-2 for the description of each of these. So, your secondary lesions, a crust, please highlight. You can see that really strong image on page 176 of that. What it is, please star and highlight dead cells that are formed over top of a wound or blemish while healing. It's an accumulation of sebum, pus, and sometimes mixed with epidermal cells. An example would be a scab or a sore. Excoriation, please highlight. You can see the image there also. It's a skin sore with an abrasion produced by scratching or scraping. An example would be a nail cuticle damage from nail biting. I think that's a pretty extreme image of it, and actually makes my stomach quite sick. A fissure. Summertime, you see this a lot as a pedicurist. It's a crack in the skin that penetrates all the way down into the dermis. It's quite painful. Severely cracked, chapped hands, lips, and feet. A keloid. Please highlight. Again, highlight the description and the name. It is a thick scar resulting from excessive growth of a fibrous tissue. Keloids will form along any type of scar for people susceptible with them. So it's kind of that raised bump on your scars. I want to stress also on your second excoriation. Please ensure you highlight that and also the description. Move down to scale. Please highlight. It is a thin, dry, or oily plate of epidermal flakes. You can see it along the hairline in that image. It's pretty common in the winter months especially. Moving on to page 177, a scar. It is slightly raised depression of the skin that forms resulting of a healing process related to an injury or a lesion. Examples would be post-operative repair. Lastly, an ulcer. You can see the image. It has that mark of depression, and it's an open lesion on the skin or mucous membrane of the body. It's accompanied by a loss of skin depth and possibly weeping fluids or pus. Requires medical referral, particularly with clients with underlying medical conditions such as diabetes. An example would be chickenpox. Let's continue on the bottom of page 177, identifying disorders of the sebaceous oil glands. Please highlight an open comedone is also known as a blackhead, is a hair follicle filled with keratin and also sebum. End of highlighting. Comedones appear most frequently on the face, especially in that T-zone area and the center of the face. You can see it on figure 8-1. When the sebum of the comedone is exposed to the environment, it oxidizes and it turns black. When the follicle is closed and not exposed to the environment, the sebum remains a white or cream color and known as a closed comedone, also known as a whitehead. It appears as a small bump just underneath the surface of the skin. Please ensure that you highlight closed comedone, also known as whitehead, and it appears as a small bump just under the skin surface. Ensure you also, at the beginning of that paragraph, highlight an open comedone known as a blackhead. End of highlighting. Let's turn to page 178. Comedones can be removed by trained professionals as long as the proper procedures are employed and the procedure is performed in a clean environment using an extraction implement that has been properly cleaned and also disinfected. As we continue, let's learn about another condition called milia. They are completely benign. They're keratin-filled cysts that appear just under the epidermis, and they have no visible opening. They resemble small sesame seeds and are almost always perfectly round. They are commonly associated with newborn babies that can also appear on the skin of people of all ages. They're usually found around eyes, cheeks, foreheads, and they appear as small, firm, whitish masses. Milia is often mistakenly called whiteheads. However, whiteheads are soft in comparison. Depending on the province or state, milia can be treated in the salon or spa. Let's move on to acne, also known as acne vulgaris. It's a skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretion of bacteria known as Propionolium bacteria acnes, so P. acne, a scientific term for acne bacteria. We'll discuss this a little bit more in this chapter. You can see an example in figure 8-3. A sebaceous cyst is a large protruding pocket-like lesion filled with sebum. Sebaceous cysts are frequently seen on the scalp and in the back, and they may be surgically removed by a dermatologist. Please highlight and star seborrheic dermatitis is the skin condition caused by an inflammation of the sebaceous glands and is often characterized by redness, dry or oily scaling, crusting, and itchiness. End of highlighting. You can see it in figure 8-4. It is a red flaky skin that often appears around the eyebrows and also beard, sometimes into the scalp and hairline, in the middle of the forehead, along the sides of the nose. It's mild flares of this that are sometimes treated with a cortisone cream. Seborrheic dermatitis is a medical condition but can be helped in the salon with the application of non-fatty skincare products designed for sensitive skin. Severe cases should always be referred to a dermatologist who will often prescribe a topical antifungal medication. Rosacea, please highlight formerly known as acne rosacea. It's a chronic condition that appears primarily in the cheeks and nose. Continue highlighting. It's characterized by flushing redness. End of highlighting. Telangiectasis is distended or dilated surface blood vessels, and sometimes even can come as form as pustules. The cause of the rosacea is unknown, but the condition is thought to be actually genetic. Certain factors are always known to aggravate this condition with some individuals. These include exposure to heat, sun, and very cold weather. When you eat spicy foods, drink a lot of caffeine, alcohol, and are under huge amounts of stress. Rosacea, please highlight, can be treated and kept under control by using a medication prescribed by a physician, using proper skincare products designed especially for sensitive skin. End of highlighting. Let's move on to identifying disorders of the sudoriferous sweat glands. Anhidrosis is a deficiency in sweating, essentially, in the inability to honestly sweat. And it's usually a result from a damage of automatic nerves. It can be life-threatening and always requires medical attention. Bromohydrosis is a foul-smelling perspiration, usually noticeable in the armpits of the arms or in the feet and armpits. It's generally caused by actual bacteria. There's several effective treatments that can vary from over-the-counter prescriptions of Botox injections and the use of even lasers on the sweat glands. Severe cases do require medical referral. Please highlight and star hyperhidrosis. It is excessive sweating caused by heat or general body weakness. Requires medical referral. End of highlighting. Malaria rubra, also known as prickly heat. It's an acute inflammation disorder of the sweat glands characterized by the eruption of small red vessels accompanied by burning, itching of the skin. It's caused by the exposure to excessive heat and usually clears in a short time without any type of treatment. On page 179, recognizing common skin infections on the skin. Conjunctivitis is also known as pink eye. It's an infection of the eye and can be caused by a bacteria or a virus. It's generally super contagious, and clients who have it obviously have irritated eyes and should be politely rescheduled or referred to a physician immediately. Never service a customer that has conjunctivitis or pink eye. Any product touching near the infected eyes must be thrown away. All implements must be properly cleaned and disinfected, as we've learned in previous chapters. Dermatitis. It's a broad term used to describe any type of inflammation and condition on the skin. Please highlight and star eczema. It's an inflammatory, uncomfortable, and often a chronic disease of the skin. It's characterized by moderate to severe inflammation, scaling, and sometimes severe itching. End of highlighting. There's several different types of eczema. The most common type is atopic eczema, which is an inherited genetic disorder. Eczema is never contagious. All eczema should be referred to a physician for treatment, which is often just a topical cortisone cream. You can see it on figure 8-6. Let's highlight herpes simplex 1. It's a recurring viral infection that often presents as a fever blister or a cold sore around your mouth, although many people have no symptoms. End of highlighting. It is characterized by the eruption of a single vessel or group of vessels on a swollen base. The blisters usually appear on the lips, nostrils, and other parts of the face, and the sores can last up to 3 weeks. Herpes simplex 2 is caused by the same virus and it's designated type 2 because it occurs below your waist. Herpes simplex is contagious, as you can see in figure 8-7, and always requires a medical referral. Drugs are now available to control these symptoms, but the virus will always remain in the body of an infected person. Impetigo. It's a contagious bacterial infection characterized by weeping lesions that are usually caused by Staphylococcus bacteria. Impetigo normally occurs on the face, especially around the nose and those different types of passages. It's most frequently seen in children, but possible at any age. Clients with any type of weeping, open facial lesion should be politely rescheduled and referred to a physician immediately. Let's talk on page 180, psoriasis. Please highlight. It's a skin disease characterized by red patches covered with silver and white scales that are usually found on the scalp, elbows, knees, chest, and lower back. End of highlighting. It is rarely found on the face. Psoriasis is caused by skin cells turning over faster than normal when the conditions are irritated. Bleeding points can occur. Psoriasis is non-contagious, but it requires a medical referral. It's treatable, but not curable. On page 180, we're going to talk about recognizing the pigment disorders on the skin. Pigments can be affected by the internal factors such as your hereditary or hormonal fluctuations, or by external factors such as prolonged exposure to the sun. Abnormal coloration such as dysteromomas accompany skin disorders and are symptoms of many systematic disorders. A change to pigmentation can also be observed when certain medications are taken, such as photosensitivity related to the use of certain antibiotics. These are the following disorders that relate to the changes of pigmentation in the skin. Hyperpigmentation means darker than normal pigmentation appearing in dark splotches. Hypopigmentation is the absence of pigment resulting in light or white splotches. Please highlight. Albinism is a congenital hypopigmentation or absence of melanin pigment in the body, including skin, hair, and eyes. It is silky white. You can see an example in figure 8-8. They're completely light. They don't have pigment. The skin actually has a pinkish white and will never ever tan. The eyes are actually pink, and the skin is so sensitive to light, and it ages prematurely. Chloasma, please highlight. It's known as the mask of pregnancy. Please star and highlight chloasma. It is a condition characterized by hyperpigmentation on the skin and spots, and that can not be elevated. End of highlighting. They're generally caused by sun exposure and can be helped with exfoliation and can be treated by a dermatologist, and usually goes away when you're done being pregnant. Please highlight lentigines. It is a technical term for freckles, small yellow to brown colored spots on the skin exposed to sunlight and air. End of highlighting. Leukoderma is a skin disorder. Please highlight. Characterized by light, abnormal patches, so hypopigmentation. It's caused by a burn, a scar, or inflammation, or congenital disease that destroys the pigmentation producing cells. An example would be albinism, so not being able to have pigment in the skin. Please highlight and star. Nevus. Nevus is known as a birthmark. It's a small or large malfunction of the skin due to abnormal pigmentation or dilated capillaries. End of highlighting. A stain It's an abnormal brown-colored, wine-colored skin discoloration with a circular or irregular shape. You can see it on figure 8-9. It's a permanent color due to the presence of just a darker pigment in that spot. Stains can be present at birth, or they can appear during aging, after certain diseases, or after the disappearance of moles, freckles, or liver spots. The cause is often really unknown. A tan, so that's going to be a change in your pigmentation caused by the exposure to the sun or an ultraviolet light. I'm seeing right now, you can see the figure 8-10, vitiligo. It's a hereditary condition that causes hypopigmentation spots. Remember, hypo is lighter, and splotches on the skin that appear milky or white. I'm seeing some supermodels, or models, not supermodels, that are walking the runways with these skin disorders now. And it's being very embraced in our culture. Recent research studies show that the disorder is part of an autoimmune disease. Skin with vitiligo must be protected from overexposure to the sun. On page 181, let's talk about the hypertrophies of the skin. A hypertrophy of the skin is an abnormal growth of the skin. Many hypertrophies are benign, which means they're really harmless. A keratoma is an acquired, superficial, thickened part of the epidermis. It's a callus. It's caused by continued repeated pressure or friction in one part of the skin, especially on the hands and feet. As the thickening grows inward, it's called a corn. Please highlight a mole. It's a brownish spot or blemish on the skin ranging from a color in a pale tan to a brown or bluish black. End of highlighting. Some moles are flat, resembling freckles, while others are raised and darker in color. Large dark hairs often occur in moles, and a change in a mole requires medical attention. A skin tag. You can see it in figure 8-11. It's a small brown-colored flesh outgrowth of the skin. Skin tags usually occur around the neck and the chest and can be easily removed by a dermatologist. Please highlight a verrucosa is known as a wart. It's a hypertrophy of the papillae and epidermis. It's caused by a virus and it's infection. It is infectious, A verruca can spread from one location to another, particularly along the scratch of the skin. A dermatologist can be helpful in removing and reducing the reoccurrence of warts. Now, this is a major problem, I would say, in our world today, understanding and dealing with skin cancer. On the bottom of page 181, skin cancer has become the most common cancer because of the large number of people diagnosed every year. It's also becoming one of the most common causes in cancer-related deaths because of general complacency about prevention and lack of knowledge about the signs and real risks, particularly in the young people. Cosmetologists should recognize the signs of potential skin cancer and always refer clients to see a physician. Better safe than sorry. Don't let somebody's young age and general good health ever fool you from being the one that saves somebody's life through an early diagnosis and treatment. Please see below that there are 3 types of skin cancer. You can see it in table 8-3. Clients should be advised to regularly seek a dermatologist for checkups on the skin, especially if there's any change in coloration, size, and shape of any type of mole are detected. And if the skin bleeds unexpectedly or if a lesion or scrape does not heal super quick. Home examinations can be a super effective way to check for signs of potential skin cancer between doctor visits. When performing a self-care exam, clients should be advised to check for any changes in existing moles and pay attention to any new visible growths on the skin. Clients should also be advised to ask a spouse, friend, or loved one to check areas that cannot adequately be seen on a routine basis. This would include your back, scalp, and around the ears. If detected early, anybody with these 3 forms of skin cancer has a really good chance of survival. Cosmetologists are unique in this way with their role to be able to recognize the appearance of serious skin disorders by referring a client to a dermatologist for early diagnosis and treatments. You can see the 3 different types on table 8-3, the types of skin cancer. A normal mole, you can see on the image part, which is on the right-hand part of your table 8-3. The description of a normal mole is a small brownish spot on the skin ranging in color from a pale tan to an almost bluish black. This is not a form of skin cancer. Next, we're going to talk about your basal cell seroneuma, most common and least severe type of skin cancer, characterized by light or pearly nodules that has 90% survival rate with their early diagnosis and treatment. Next one is squamous cell carcinoma, more serious than a basal cell seroneuma, characterized by scaly red papules or nodules. It can spread with other parts of the body, and the survival rate depends on the stage of the diagnosis. Last one, your malignant melanoma. Least common, but it's the most dangerous form of skin cancer, characterized by black or brown patches on the skin that may appear in uneven texture, jagged or raised. Malignant melanoma is the least common, but it's 100% fatal if left untreated. Early detection and treatment can result in 94% to 95% 5-year survival rate, but it drops drastically 62% once it reaches local lymph nodes. According to the American Cancer Society, professionals should always abide by the ABCDE cancer checklist to spot the signs and change the existing moles. Figure 8-12A, a normal mole. You can also see a normal mole in 8-12B, 8-12C. You can see with a cancerous lesion, and 8-12D, another one with a cancerous lesion. Your ABCDs in your cancer checklist is A for asymmetry, half the mole does not match the other half. B, the outline or the border irregularity. The edges of the mole are ragged and notched. C, the color of the mole is not the same all over. It can be shades of tan, brown, or black. D, the diameter. The mole is wider than about 1/4 inch. And E, the evolution. The mole is evolving and changing. It can be darkening, it may itch or hurt, and it may change in shape or growth. Examining problem skin and acne. Common skin problems that affect clients' appearance, such as acne, can be a source of a great concern. It's a major concern to anybody who suffers from it. Frequently misunderstood to be teenage skin disorder, it can also affect anybody at any age. Women often do not have acne problems until they reach their 20s, 30s, or beyond. Because acne affects the appearance, it's an interest to cosmetologists and also estheticians. A predisposition to acne is based on hereditary and hormones. People with acne inherit a tendency to retain cells and gather the walls of the follicle, eventually clumping and obstructing the follicle. Hormone levels directly affect the function of your sebaceous gland, increasing and decreasing the levels of the hormones in the skin. I'm going to let you read most of page 184 on your own. The only thing I want you to highlight is on page 185. Whenever you're dealing with makeup and acne treatment, always make sure that when you're applying makeup, you use a non-comedogenic form of makeup, which means the product has been designed and proven not to clog follicles. You can see that on your highlighting on page 185. Most acne can typically be treated in a salon, and anything that is extreme, please always refer to your doctor or dermatologist. On the bottom of page 185, you're going to see interscenic factors. They're skin aging factors which we have little control. 1 being genetics, 2 being gravitational pull, and 3 being our facial expressions. These factors, if you turn to page 186, please highlight. Extrinsic factors are primarily environmental factors that contribute to aging and the appearance of aging. End of highlighting. Many scientists and dermatologists believe that these factors are responsible for 85% of skin aging. They include exposure to the sun, tanning and sunbathing. They're major offenders of this and also cause skin cancer. Smoking. It's more than just bad for your lungs, it's bad for your body as a whole and does significant damage to the skin. Smoking produces tremendous numbers of free radicals amongst your skin, and it makes those molecules super unstable and causes biochemical aging. Overuse of alcoholic beverages. It has an overall effect of the body and the skin. It inhibits the body from repairing itself and interferes with proper nutrition and distribution in the skin and body. Stress plays a huge role on our overall health and contributes to premature aging of all organs, including skin. It confirms that stress causes biochemical changes in the cellular level that can lead to tissue damage as well as aging. On to page 187, poor nutrition. It deprives the skin of proteins, fats, carbohydrates, vitamins, and minerals that are required to maintain, protect, and repair the skin, keeping it looking young and beautiful. Make sure you eat well and live a well-balanced diet. Exposure to pollution. It produces free radicals, interferes with proper oxygen consumption, and affects the lungs and lots of other internal organs as well as the skin. The best defense against pollutants is a simple one. Follow a really good skincare routine. The appearance of aging skin can be improved greatly by practicing a good skincare program, especially at home. On the bottom of page 187 is understanding the sun and its effects. Please highlight. The sun and its ultraviolet effects have the greatest impact of factors on how the skin ages. End of highlighting. Please highlight. As we age, the collagen and elastin fibers of the skin naturally weakens, and this weakening happens at a much faster rate when the skin is frequently exposed to UV light without proper protection. End of highlighting. You'll need to also highlight and learn your UVA rays, known as aging rays, are deep penetrating rays that can even go through a glass window. These rays weaken the collagen and elastin fibers, causing wrinkling and sagging of tissues. Please highlight and star this. UVB rays, known as burning rays, cause sunburns, tanning of the skin, and the majority of skin cancers. Please star these. These are shorter rays that stop penetration at the base of the epidermis. I'm going to let you read about protecting yourself from the sun. And also in your figure 8-14, the different types of burns that you can succumb to. Always try and ensure that you have a great sunblock on to protect your skin. I don't believe myself as a professional recommending to you an SPF of 15 is strong enough. I believe in this day and age we're educated. You should be wearing a way stronger type of SPF to protect yourself so you can limit your skin cancer. A first-degree burn, a second-degree burn, and you can see how badly a third-degree burn is. There's a few points that you want to touch on. Always make sure that you have an SPF on daily. Look for products that always contain zinc oxide or titanium oxide. Avoid prolonged exposure to the sun during peak hours. It's usually between 10 a.m. and 3 p.m. Always apply your sunscreen 30 minutes before the sun exposure to allow it to have time for full absorption. Apply sunscreen liberally after swimming and after activities as a result from heavy sweating. If the skin is exposed for hours to the sun, such as during a boat trip, a day at the beach, sunscreen should be applied several times. Please highlight and star. Avoid exposing children younger than 6 months of age to the sun. Please star this. People who are prone to burning frequently and easily should always wear a hat and also protective clothing when participating in outdoor activities. On the bottom of page 189, let's talk about contact dermatitis. Please highlight, contact dermatitis is an inflammation of the skin caused by having contact with certain chemicals and substances. Many of these substances are commonly used in cosmetology. There's two types of contact dermatitis: allergic contact dermatitis and irritant contact dermatitis. Allergic contact dermatitis. An allergy contact dermatitis, please highlight, occurs when a person develops an allergy to an ingredient or chemical used by repeated skin contact with a chemical. For example, there's a reason that we use gloves when we're working with chemicals. You are repeatedly touching hair color, lightener, chemical relaxers. Having your body absorbing those chemicals is not healthy to you, and you will develop contact dermatitis, or at least a sensitivity to it. So continue on with sensitization, and it's an allergic reaction created by exposure to a chemical or substance, and a highlighting. Moving on to page 190. I'm going to let you continue to read this, and I just want to highlight on the page 190 two things. Irritant contact dermatitis, abbreviated ICD. It occurs when irritating substances temporarily damage the epidermis. So what happens is it's not chronic, but it will damage if you're exposed to it. A corrosive substance like a cleaning substance could be a good example of it. Always make sure, how are you going to prevent this? Always use gloves and utensils when applying chemicals and hair colors and straighteners, and also perm solutions. Nail technicians should be using gloves when applying nail products and liquids and powders, including estheticians, and also face masks. Frequent hand washing can result in dry hands, and cracks in the skin can cause more irritation. So to recap, I'm going to practice these suggestions with great diligence. Always protect yourself. Highlight, wearing protective gloves where using products is known as an irritant or allergen contact dermatitis. Keep your hands sanitized and keep them moisturized. And at the end of this chapter, I want you to do a typical standard, reviewing your questions, look at your study tools, look at your study guide, and I want you to go over your flashcards and chapter glossary. Again, if you have any questions at any time, contact me so I can help assist you and ensure that you understand the material fully. Thank you, and let's look forward to chapter 9.